Hi, my name is Lynn Webster, and I am a family and education advocate here at the Mental Health Association. And I am coming to you today for Wellness Wednesday to talk about the different states of when it comes to suicide. So the ideation, plan, intent, and an actual attempt. There are differences. The reason that I feel that this is important is recently there was a situation where it involved myself and my son and something that I had said about my son, and the person took it, they made a statement that wasn't true. Now this was not done intentionally, and it showed me that I failed to educate. And this is what I do here at the Mental Health Association. One of the parts of my job is to educate people about mental illness. And it just showed me that this person didn't understand that there's a difference between suicidal ideation and an actual suicide attempt. So that's why I'm here today, to tell people about the difference. So suicidal ideation is just basically you have a thought about it. And there are different levels of risk when it comes to this. So, you're mad because you failed a test and you're like, oh, I should just go kill myself. A lot of people make that as a statement. But there are some people in different states of their mental illness that have these intrusive thoughts that tell them actually that they should kill themselves. It would just be easier to just end it. And of course you have to be mindful of that. And you do want to take it seriously. So in my case, when my son has said this before, we have a conversation. Open communication is very important. So we have a conversation and we talk about it. Do you have a plan? Do you really mean that you're going to do this? And he'll say, no, Mom, I don't really mean it. It's just, sometimes I can't get my brain to stop talking to me and to shut down. So I just think sometimes it would be easier. I also will ask him if he feels he needs to go to the hospital. And because we have that open communication, he would tell me if he did. So the next would be, as I mentioned, a plan, which a person actually has thought about. I should say swallow a bottle of my medication. And I'm not saying this so that you think that this is what he has done. I'm just giving that as an example. Now, if a person does have a plan, again, you want to take that seriously. And you do want to seek support. So whether it is them talking to you, them talking to their therapist, their psychiatrist, that type of thing. Intent, again, means that they really are thinking about doing this and following through with their plans. So again, that is an even higher level of risk, and you again want to make sure that they are talking to their therapist, their doctor, a safe person that they have. An actual attempt is just that. It's an attempt. They have the plan, they have the intent, they actually follow through. Obviously, this is very, very serious and needs to be taken seriously. And again, after that, you would want to create a support system so that it doesn't happen again. You want to make sure that that person in your life knows that they have people that they can turn to should this happen again, should the thoughts get so overwhelming and they just don't think that they can handle this. So again, a treatment team of sorts, whether it's in school, a school counselor, a favorite teacher, whatnot, therapist, doctor, any person that they are close to, that type of thing. You want to make sure that you wrap that person with enough supports. And the biggest thing that I think I can say as far as that, please don't judge. A lot of times people feel that they are judged, and that could be something that sets them off or really makes them think that they should do this. Now, part of why I felt it was important, again, to educate, because in the situation that it happened with myself. Again, this person didn't understand the difference. This statement could have unintentionally set something like this into motion. It could totally affect a person's life that has mental illness if outside people think that this person has actually made attempts or is thinking about it or whatnot. Again, because people judge and they think, oh, I don't want them to do this or I don't want them to do that, so I'm not gonna have them, work with me, volunteer with me, that type of thing. And it doesn't mean that this person intentionally meant to do that, because they didn't. They just didn't know. So as families, we want to make sure that we're educating people about our loved ones that have mental illness, and again, about the different parts that go into suicidal ideation and an actual attempt and whatnot. Lastly, as far as a person having mental illness, there is sort of a responsibility on you to say, reach out, make sure that you're identifying a safe person, somebody that you are so comfortable with that you can know that you can tell anything to. Please, please do that. And also educate us, whether it's your family or your friends or your, school, whatnot, and make sure that we understand, because I don't always understand with my son what is going on. I'm not inside of his head. I don't know what it feels like to be him. So he has to educate me and say, Mom, stop. You're not understanding. You're not listening. So if you have any questions at all, or please do not hesitate to call us here at the Mental Health Association, 325-3145. We have many people here, whether it's for families, family support, or peers, which work in peer services, and we would be glad to answer any question that you could possibly have. So thank you for listening to me on this Wednesday, and have a great day. Take care.